So let's talk about bunions. When do you need to see a podiatrist for your bunions? When do you think you even have a bunion? So a bunion, a 16-year-old can have a bunion, and an 86-year-old can have a bunion. So it does happen at any stage. I would say 14 or 16 would be the youngest because that's when your bones are actually forming. So when you are wearing your shoes and you see a part of your foot that is sticking out from the shoe, that means you probably have a bunion. Do we need to do surgery on all bunions? Well, it depends. How much is it bothering you? Is it for just cosmetic reasons or do you have pain? I tell all my patients and family members that if your bunion is hurting, don't wait too long. Your bunion will not get better on its own. It only gets worse. So if your bunion is hurting, waiting and wearing toe spacers does not help. As you age, your bunions only get worse. As you are on your feet, your bunions only get worse. So if your bunion is hurting, I highly recommend that you seek a podiatrist and talk about your options. But what if your bunion is not hurting? So what does that mean? It just means when you're standing on your feet, you see a bump on the outside of your big toe. And this bump in your shoes can just stick out. So if you wear a sandal, some of my patients, I've noticed that they buy sandals that the straps are so strategic that the bump is actually sticking out and not hurting them. However, if you have to wear closed-toe shoes, if you have to wear your formal shoes, professional shoes, the bump is not going to be sticking out of your shoe, so it will be causing you some pain. And that's, again, when you should probably see a podiatrist. No two bunions are the same. When you come to see a podiatrist, your podiatrist has to evaluate your bones, your range of motion, how your bones feel, how big the bunion looks on the outside, as well as when they will take an x-ray and they actually have to look at the bunion from the inside. What does that mean? That means we have to look at angles. There are several angles that we look at. One will be from your foot on this side. One will be from your foot from this view. And an knowledgeable podiatrist knows are their angle measurements, and they'll be able to tell you what kind of bunion surgery you need, whether there is need for any screws or hardware, and how long you have to stay off of your feet after the surgery.